Good evening, everyone. It is Sunday, May 17th, and I will start with the sort of roundup of our daily statistics with respect to COVID-19 in Sonoma County. So starting out with a total number of cases, we now have 387 cases, which comprises 0.08% of the population. That includes 179 active cases, 204 recovered cases, and still those 4 fatalities. Of the cases, in terms of the gender breakdown, we have seen 200 female cases and 187 male cases. With respect to the geographic breakdown, we've got 28 in North County, 62 in South County, 21 in East County, 20 in West County, and 251 in Central County. We still have 5 under investigation. The good news, I think, is that we have a huge number of negative tests in Sonoma County, and that our current sort of positive rate for the number of tests that we're doing is less than 3%. So it's around 2.6%, but rounded up, we count that as 3% positive and 97% negative. And that is out of, we've got 14,177 negative tests and 387 positive tests. So that's a really good sign. The good sign is that our testing numbers are increasing. We really are ramping up those testing elements, both the surveillance work that we're doing, as well as the testing of asymptomatic and symptomatic close contacts of confirmed COVID-19 positives. So 14,000, I feel good every time I see those numbers go up, and every time I don't see the huge dramatic jump in the positive tests, of course. In terms of age breakdown, we are seeing we have seen 60 cases in the 0 through 17 age range, 198 in that 18 to 49 age range, 81 cases in the 50 through 64 age range, and then 40 in the 65 and over. Critically, we also want to look at where are those positives coming from. So we have 48 that are travel related, 73 that are community spread, but the majority of our cases are of those close contacts. So 240 are close contacts. 26 remain under investigation. I do want to share that if you go to socoemergency.org and you click on the dashboard, there's actually new information there. So we now are actually breaking out symptoms by age range, and we also have information regarding whether someone had a co-occurring condition based on their age range. So I wanted to point you there to sort of, if you haven't checked it recently, there's actually some new information there. I apologize, we still do not have the criteria dashboard up. I know I've been talking about that for weeks now. I can say that we are very close with respect to being able to be completely transparent with the community about where we are on the criteria, but we actually heard over the weekend that the state may have some new criteria. Fortunately, it sounds like we are actually meeting those criteria, but we wanted to wait to be able to get that on the dashboard as well so that we have all of the information in one place before we post it online. I do want to remind you that the most recent news from the county is regarding the amended shelter-in-place order. That went into effect on Friday, and so now we've got a few new businesses that are allowed to operate. That includes childcare facilities, residential and janitorial cleaning services, car washes, pet groomers, dog walkers, outdoor museums, open-air galleries, botanical gardens, and outdoor exhibitions, as well as office workspaces only where teleworking is impossible. So got all that information there, and I'm actually going to try to keep this one a little bit short and go straight to questions because I've got a board meeting tomorrow. So I know normally board meetings are on Tuesday, but we actually have 2 Board of Supervisors meetings, both on Monday as well as on Tuesday. If you're interested in winery events, that will be held this week. That's on Tuesday, and on Monday we have our COVID-19 update. So that's where if you're interested in what's happening, if you want to hear directly from Dr. Mace and our Director of Health Services, Barbie Robinson, you'd be more than welcome to tune into our board meeting, which starts tomorrow at 8:30. And I'm just gonna make sure that I've got see if there's anything ahead of the agenda before that. But no, it looks like we go straight into, at 8:30 a.m. is the novel coronavirus COVID-19 threat response, reopening, and recovery update. And then after that, we'll see the update on services being performed during the COVID-19 event. So if you're curious about latest and greatest news from the county, feel free to tune in at 8:30 a.m. tomorrow. You can go to the County of Sonoma's website and it'll be broadcast there. So, all right, I am going to go ahead and go over to questions because I still have to read through my agenda packet. And again, if you're interested in winery events, don't forget that is on Tuesday. So we'll be considering, and it's not an official ordinance or anything that we're voting on, but it is an opportunity for the Board of Supervisors to hear from the public, to hear a presentation from staff, and then to provide direction about what we want to see with respect to regulating winery events into the future. All right, I'm going to go ahead and scroll through and start taking questions. All right, have a question from David. I have a question about testing requirements. Is the 800 tests a day requirement met by ability to do tests or actually doing tests? What if not enough people sign up to get tested? That is a great question. I believe it actually refers to the capacity. So if you have the ability to process 800 tests a day, and you've shown that on occasion you have actually met that 800 tests a day capacity, then that's a green light as far as I understand from the state's requirements. So it does definitely ebb and flow based on how many people are signing up day by day. You would not have to, for instance, sustain 800 tests a day for 14 days. You just needed to be able to demonstrate that through various laboratories and various testing facilities within your county, that you do have that capacity to meet the number of tests per day. All right, scrolling through. Question, do you know what the youngest age is of the 0 through 16 positives? I don't, but I actually do think that there is a tighter breakdown that was posted online. So check out socoemergency.org and see if you can find any additional information, because I do know that there was new information posted that gave a little bit more detail, because we've been all asking for that for a while. I can definitely look into that and find out if the county is willing to share what the youngest person who was a confirmed COVID-19 case. I will definitely follow up on that. All right. Question from Peggy. What about opening libraries for pickup only? I think this is a fantastic idea, and this is something I've actually been reaching out to the library about since shelter in place started. So gosh, I think someone said today that I think I read it in the newspaper that it was day 61 of shelter in place order. I trust that. It feels like it could be day 161, who knows? But yes, I do believe that the library system is going to be moving forward with some ability to do some kind of pickup service. So I imagine that would probably be something like the curbside pickup that we're seeing with retail, but I don't have any information, and the county is not actually in charge of the library system. So there's actually a separate library commission that oversees that. But I am friends with Ray Hawley, who is the communications person for the library system, and I can definitely see if we can get some more information about library pickups for you. Question from Sastra. Had detailed guidance been given to daycare operators? I feel unsafe sending my child and don't know what the new standards of care are. This is a great question. There are actually currently 2 standards that daycares have to, and licensed childcare facilities have to abide by. First of all, they have to abide by the local public health order. And second of all, the licensing agency, which is through Human Services at the state level, also has actually even more stringent guidelines. So there are actually 2 layers of protection that actually makes it, quite frankly, challenging for daycare to comply with, right? They're really held to an extremely high standard. So that includes the sort of maximum size of the group of children. It includes not having any sort of shared facilities between groups. So there are a number of standards, and I would encourage you to look at both our socoemergency.org to review the public health order, if that will make you feel better. And then you can also actually look at the state website. And I forget what the state website is, but I'm sure that I can look it up and post it in the comments when I'm done here. I've actually looked it up, and they have these horrible numbering system for their different information for their child care providers. And so you have to know which one it was. I think it might have been 19 or something like that, but it's a series of acronyms, which is not the easiest thing to follow along, I'm sure, for all of our daycare providers. I did request actually an update on childcare as part of tomorrow's Board of Supervisors COVID-19 update. I'm not sure if that was able to be pulled together in time, and I haven't gotten a chance to look through the presentations yet. So it's a possibility that we also might learn more tomorrow at the Board of Supervisors meeting. Question, any consideration about the new form of virus that is hitting the young children? How is this being tracked, and is it under consideration for how childcare will be implemented? I know that Dr. Mace is on regular briefings with both the CDC as well as CDPH, and I'm sure this is something that she is tracking closely. My understanding, and definitely I can say that as a parent, I found that information and that news extraordinarily alarming. But when you look at sort of the total percentage of cases, it's still fairly low compared to the more severe complications that ultimately, have caused a lot of fatalities in the older population, and also with people with co-occurring illnesses. And so I know that it's definitely something that she is tracking, but in my conversations with her, she is still top of mind concerned about those other groups that are, so far proving to be more susceptible, and certainly with respect to fatality, experiences of COVID-19. All right. Scrolling down, are we watching countries like Germany that have opened elementary school with limited increase in cases to see if there might be a model for Sonoma County? Christine, this is a great question. And I have actually been in conversation with one of our local superintendents just over the weekend. I do know that Dr. Mace had a phone briefing with all of the superintendents around Sonoma County, and they are having discussions about what school could potentially look like in the fall. And I'm actually going to be having a meeting later this week with all of the superintendents in West County to hear directly from them. One of the things that's becoming apparent is that there's probably not going to be a one-size-fits-all solution for returning to school, because at the end of the day, it's really going to depend on each individual school, right? How much space do you have? How many students do you have? What's your faculty, to student ratio? And so while all of the districts around Sonoma County, and there are a lot of them, are collaborating and coordinating, they may ultimately wind up implementing slightly different measures. And I've also heard from some of the superintendents that they feel that there might be best suited to be slightly different strategies for younger children, say grades, K or TK through 5th, compared to, your sort of middle school and high school students. And so stay tuned, because these conversations are definitely happening. You might have read in the newspaper that our superintendent of all the schools of Sonoma County Office of Education, Dr. Steve Harrington, did send a formal letter to Dr. Mace as well as the Board of Supervisors, essentially seeking guidance and input with what school could look like in the fall. And I do want to be clear that I have been very, very focused on sort of daycare, preschools, right, and schools, because I really feel that we can't talk about reopening the economy unless we talk about childcare, because ultimately we have a lot of our workforce that are parents, and if they don't have a safe place for their kids to go, then that becomes very concerning. And I've also heard from a lot of teachers as well as local superintendents that they're very concerned about some of their most vulnerable students, right? Folks whose parents were sort of struggling to make ends meet and not knowing whether or not they're getting those full meals that they were getting at school, not knowing how it's going with distance learning when you have, parents who may be trying to sort of both work and then also take care of their children. And so a lot of folks are, I think, really, really interested in not only making sure that our kids are safe and schooled, but also making sure that we have a safe transition for the workforce as our economy begins. Some people are calling it a waiver, and I really don't think that that's a good word for it, right? Because it isn't a waiver. It isn't a waiver of requirements. It's actually our public health officer stating that she feels that we actually do meet the criteria, and here is how, and here is the plan for actually. All right, hopefully I'm back. I saw that for some reason my iPad was trying to use cell signal instead of my Wi-Fi, but hopefully now you can see me again. Question from Kara, how is it we can keep opening with not having the low percentage of positives per capita and a death in the past 2 weeks? And this is a great question. And this gets to the question of what is this process that the county is going through that actually, is it seeking a waiver from the state requirements? What does it look like? And so I really prefer to not call this a waiver process. And that is not about, double speak or trying to sort of, be political about it. It's because it's really about setting appropriate criteria. The state kind of, drew these lines in the sand. And actually, Dr. Mace was on a phone call with all of the different public health officers and CDPH, and she asked, was there a study that supported these lines? What was the data that drove these decisions? And at the end of the day, the state wanted to start somewhere, right? So they kind of drew these lines in the sand, and they said, okay, we know that if you're a county that's under that line, you can move forward into phase, quote, 2B, right? So which is a little bit further into phase 2. It's not in any way, shape, or form a full reopening of the economy, right? We're not going to be opening up the doors to huge events, right, to life as we knew it before COVID-19. No, this is really about a thoughtful, phased approach. And what are those sort of local metrics and criteria that make sense? And we've actually gotten news, as I mentioned earlier, over the weekend, that the state is actually already reconsidering their criteria. And it looks like Sonoma County would actually meet the new criteria anyway, even without a variance or attestation process or a waiver. But that said, the existing criteria did have that rule regarding fatalities. They also had a rule that said that you could only have one case per 10,000 residents over a 2-week period. And partly because of our extremely aggressive testing that we've done and our contact tracing, which is among the best in the state, that's one of the reasons that we actually don't meet that, because we're actually catching, a huge number of these asymptomatic folks who came into close contact with confirmed COVID-19 patients. And so with that thought, some of the other counties in the state, like San Luis Obispo, who also have aggressive contact tracing programs, they actually submitted an attestation to the state stating that while they have more than 1 per 10,000 cases over 14 days, that actually the majority of those cases are isolated and quarantined right away, which means that they're not actually out there actively spreading in the county and in the community. And they're also not community spread cases. Those are the ones that we worry more about, right? A community spread case is a case where you don't actually know where it came from. And so that means that there are people who are, potentially asymptomatic or who are symptomatic and who are going to work anyway and not getting tested. That's where we start to worry, because that's where you can really see the disease start to break out. If we're actually finding those confirmed positives in close contacts of other confirmed positive patients, that's actually a good thing, because we're able to then get those folks to isolate in their own homes, right? And to stay out of society and to not affect others. So anyways, that's the process that we're going to be going through early this week, is submitting a formal attestation to the state. But again, it looks like the state is actually on the cusp of shifting their own guidelines and criteria slightly in a way that actually might make Sonoma County qualify anyway. But we still want to pass up that plan to the state, because it's not just, sort of saying that, we think that we meet, a different set of standards. It's actually also talking about how are we going to thoughtfully, phase open our businesses, and then how can we potentially ramp back down, right, if we start to see an increase in cases, or if we start to go slip above those different metrics. So anyway, stay tuned on that. There should be hopefully more information about that at the Board of Supervisors meeting tomorrow. So, all right. Merlin just shared some interesting news that I will definitely pass on to Bert Whitaker. He says, are you aware that as of yesterday, charter boats have been given permission to operate and are doing so out of Berkeley Marina? They have mitigation protocols in place for the boats, crew, and clients, and all went well over the weekend. Myself and Captain Rick Powers and the rest of our captains think we can do this in Bodega Bay. When do you think we can discuss this with Bert Whitaker? Is tomorrow doable? Tomorrow is not doable because I have a board of supervisors meeting, although it might get out early. So let me check with the clerk, and if it's possible, I would definitely love to talk to you and Rick in the afternoon if Bert Whitaker is available. I did get your email before, and I was going to actually sort of have us sit down and talk with, or virtually sit down and talk with Sheba Pearson-Whitley of the Economic Development Board, because she's the one who's in charge of developing those best management protocols. But I would be happy to try to loop in with Bert, because if there is an existing model, it would probably be good to flag that to his attention. Question from Tony Ratto. When do you think lodging and tourism will return? This is a great question. And I do know that actually, I was refreshing the state website and looking over at it over the weekend, because they have actually shifted some different industries to different phases. And so that has also been an evolving document, right? Here's the thing, is that as in government, as we learn more, we are adjusting, right? As we are seeing what is happening in other states and other countries, we are sort of stealing from those best management practices and implementing them locally. And so I did see that there is actually, some potential phase reopening of some sorts of tourism and sort of hospitality industry in late phase 2, I believe. But it's sort of, some of it's in phase 2 and some of it's in phase 3, and the state has not yet been clear with respect to what falls where. So unfortunately, I don't have a firm answer on that, but we should have some more information if in fact the attestation does go through, and in further conversations with the state about what we can reopen when. Question from Debbie, can you break down the cases in home care facility? Just be nice to know if a lot of the positive cases are isolated in home care facilities, so it doesn't seem so bad all around in the community. It's unfortunate they are getting hit so hard. I agree. The skilled nursing facilities have been hit extremely hard in many parts of the state and the country. And unfortunately, it's one of those congregate living, settings where the disease can spread very quickly. I really want to applaud Dr. Mace, because she took early action on skilled nursing facilities, including not allowing employees to work between different facilities, because we were actually seeing that spread around the Bay Area, where employees would sort of bring it potentially from one facility to another, and where she also implemented really stringent protocols around monitoring employees, as well as making sure that there are strict masking guidelines there. And so I think that has been helpful so far in Sonoma County, but I can definitely look into whether that is a level of information we could share. So if we could share what number of cases we are finding in skilled nursing facilities and others. All right. Question from Debbie. Can the local fire department and police go around and visit businesses to make sure they are following guidelines? And I'm trying to click see more, and for whatever reason, my screen is not working. So I am just going to assume that that's the majority of the question, which is, can the local fire department and police go around and visit businesses to be sure they are following guidelines? I know this is happening fairly aggressively within certain cities, but ultimately it's up to the local law enforcement jurisdiction. And so some have more capacity than others. I know the city of Santa Rosa actually developed their own team to do this. So they've actually been very proactive with respect to, reaching out to businesses. And there were some businesses that actually opened up in violation of the public health order. I know that Dick's Sporting Goods opened up, I think it was last week, and they were actually shut down by SRPD. So that is definitely happening. And it's ultimately the jurisdiction of the local law enforcement agency, not the fire department. So if it's an unincorporated area, do call the sheriff's non-emergency number, which is 565-2121. Again, that's 565-2121. All right, scrolling down. Can dental offices open for elective procedures like cleanings? That is a great question, and I feel like I know the answer to that, but I don't want to spread misinformation. So I will look that up and I will get back to you. I always, sort of pause if I think I know the answer, but I haven't just, read that document recently enough. So I will look into that. I do know, actually, though, I can share with you that dental offices are eligible for receiving PPE from our Emergency Operations Center. So if you have a dental office, I know that there were some dental offices that actually were remaining closed because they had inadequate PPE. I asked that question of our Department of Emergency Management manager, Chris Godley, and he said that they could actually request PPE from the county. So if you've got a dentist, if you are a dentist, if you need PPE, please let us know and we can help connect you to that. Question from Erica: what is happening around mental health? We do have a warm line available. And so, unfortunately, I don't have the phone number, but I'm hoping that Leo is watching and he can post that in the comments right there. The warm line is available for anyone who is feeling any kind of stress or anxiety or, emotional, just they need to talk to someone, right? And so we've got therapists who are there who can talk you through it, who can refer you to resources if you need it. And of course, if you are in a crisis situation, do please call 911. Please call 911. We can get you into our crisis stabilization unit. We can make sure that you have the help that you need. And in the meantime, we are doing a lot of advocacy because I firmly believe that we are going to need to really increase our mental health resources here in Sonoma County. It's not just the pandemic, right? The pandemic is hard on everyone, but here in Sonoma County in particular, we have gone through hell and high water over the past few years, multiple times, right? So it was fires, floods, fires. Some children also experience the trauma of having school lockdowns as a result of threatened gun violence. Obviously we witnessed other mass shootings around the country as well. And so I think it is absolutely critical that we really pay attention to mental health and that we try to strengthen our safety net, both peer supportive services as well as, professional and clinical services. And I think that when schools reopen, it's going to be really critical to make sure that we have adequate counselors on all of our campuses around Sonoma County, because I know that this has not been easy on our students. All right, moving through. I did already answer the question about testing, so I'm seeing that one again. Let's see. Tony says, I have concerns about uneven, inadequate PPE policies and practices at local hospitals and clinics. If healthcare workers are at risk, we are all at risk. Can you address this? Absolutely. I completely agree with you. And this has been a very significant frustration of mine because, first of all, we've been working our tails off at the county to make sure that we are buying hundreds of thousands of masks, gowns, you name it. We have sourced every kind of PPE from every crazy source available, everything from Amazon Prime swabs to, we are importing, masks from a contact at Healdsburg District Hospital we've just been turning under every, possible rock to try to find these supplies to make sure that our nurses, that our physicians, that everyone who works in a healthcare facility would be safe. So it's extremely frustrating when we see that, hey, some clinics are doing amazing and they have, everyone is wearing N95s and all of their employees feel extremely safe. And then I have actually heard reports that we have, in some instances, nurses who are taking care of confirmed COVID-19 positive patients who are not wearing N95 masks. And so that's very frustrating. And so, it's an issue that we need to raise. I understand that HPEACE is going to be bringing this up later this week. And I have also asked Dr. Mace if there's any way that she can address this with our healthcare providers. So stay tuned. We're doing a lot of what everything that we can on government side to make sure that we've got those supplies for our healthcare workers. But ultimately, this is the crazy thing about a fragmented system, right? You have, one clinic and one hospital, and they have different policies than another one. And so hopefully there's some work that we can do maybe through the public health side to try to bring them all in alignment and ensure that our workers are safe. So thank you very much, Tony, for asking that question, because there is nothing more important than keeping our healthcare workers healthy. I mean, this really applies to all of our frontline workers, but those are really truly the front of the front line. And if they're not healthy and they can't take care of us, then no one in the community is healthy. Comment from Curie. Hope the state park beaches aren't open until after Memorial Day in fear of them and our first responders being overrun. Thank you for that feedback. I really appreciate that. I believe that is the conversation that's happening right now. Again, nothing formal, but I'm thinking that probably Marin and Sonoma Coast won't open until after Memorial Day. That was kind of what the signaling was from Marin, and there is interest in trying to be in alignment with Marin so that we didn't have one of the coasts open and one of them not, and then everyone sort of flooded to the one. We kind of want to open, as a united front. And I haven't yet gotten to have that meeting with our first responders, but we are planning on checking in with all of our coastal fire departments to make sure that they are ready for reopening when it rolls out. I did receive some frustrated calls, I will be honest, this weekend from some coastal residents who felt that they were just still being inundated with out-of-towners and that there wasn't adequate sort of enforcement and personnel, especially on the state park side. So I followed up with that over the weekend with Regional Parks Director Bert Whitaker, and we'll continue to have conversations about that this week and see if there's anything else we can do. All right. This is from Heidi. June Bugs Skin and Body here. Aesthetics beauty businesses run their businesses strictly abiding by the California board. Any idea on when we can start up? Unfortunately, I do not. And again, that was something that was targeted for a later phase in the state's plan. I know that's frustrating, and I recognize that actually a lot like, childcare providers and really all of these types of beauty businesses. I've heard this from tattoo artists. I've heard this from, hairstylists, that everyone has to go through very, very rigorous training. And so, the licensing requirements and the sanitation requirements are extensive. And so I've heard some frustration that, I feel that I can keep myself safe. I feel I can keep my customers safe, and yet I'm not being allowed to open up. And really the only thing that I can tell you, I know that it's very, very frustrating. This is being driven by the state at this point in terms of the phases, right? And even if we're able to go further, right, we'd only get to go into phase 2B. So it's not into phase 3, which is when personal services would be available, which would include aesthetics and beauty businesses. But this is the way that Dr. Mace explains it to me, right? Every business, no matter what you're doing, whether it's a school, whether it's a commercial business, whether it's a nonprofit, there are 3 main risk factors. Those risk factors are, number 1, how many hosts are there, right? So hosts doesn't mean like a friendly person who's going to entertain a guest. That means how many potential hosts for the virus. So how many people are coming into contact with other people. Number 2, how close are they, right? Can you maintain that 6-foot distancing or can't you? Number 3, what's the duration of contact? Because we know that the longer that someone is in contact with another person, the much higher likelihood of them actually transmitting COVID-19. And so while personal services don't necessarily fall into the high risk category for that first tranche, right, in terms of the number of people coming into contact with one another, because you could probably control that, they do sort of hit the high risk marks for those other 2 categories, which are the duration and the proximity of the contact. So that's one of the reasons I believe behind the state having them in a later phase. So again, I know that it's very frustrating, and if you're having any challenges with getting unemployment, there still should be that unemployment available even if you are self-employed. So hopefully, I know that you want to get your business back running, but right now it is not permitted. Question, do you have any idea when state beaches and parks will open locally? So we are having conversations sort of to try to open things, universally. So that means not having regional parks get out in front of state parks, or not having state parks get out in front of regional parks, right? Having a whole coast approach. And we are also having conversations around coordinating with Marin, because we know that we actually share a very similar situation to Marin County, where we have a very rural, low sort of population density coastline that's within a stone's throw of millions and millions of people, which means that it's very easy for that rural infrastructure to get overrun and to create public health concerns, especially as it pertains to first responders. So we are talking to our, going to reach out to our first responders. It's going to be actually one thing I almost forgot. I think Elise Van Dyne would kill me if I forgot to mention this. We are having our coastal MAC meeting, and this will actually be a topic of conversation. And I'm pulling up my calendar right now. I'm cheating to see when that is. I think it's either Wednesday or Thursday. Wednesday the 20th. So Sonoma Coast MAC meeting, it starts at 5:30 this Wednesday, May 20th, and it will be live streamed right here on my Facebook page. And there's also a Zoom link if you want to participate. And we'll be discussing the reopening of the coast at that point in time. And we're going to have that conversation, and we've invited different participants, and we'll have our coastal MAC representatives there to discuss it with you. So feel free to chime in there. And I see Elise has already chimed in with the warm line. Mental health and wellness warm line is 565-2652. That's 565-2652. Jeanette Owen says there is a video going around about a nonprofit filing a lawsuit against the city, county, and state. I understand there are two different sides to every story. I'm trying to understand if businesses who have started to sell essential items and following safety protocol, why are they being shut down? We want to support local as much as possible, and it makes me scratch my head that we are closing them, but Walmart and HD are good to go. Please help try to bridge the gap and educate us. Thank you, Linda. Thank you so much for that question, Jeanette. And I will be totally honest, I did not know what crossing the Jordan was until I got sued by them. And so we have a lot of different nonprofits that operate in Sonoma County. A lot of them have absolutely amazing, wonderful purposes and are doing really, really good things. I cannot comment on ongoing litigation because I was literally personally named in the lawsuit. But I can say that I have worked with other nonprofits to try to find creative ways forward, to help them because a lot of them, quite frankly, had to cancel. They had to cancel events, right? They had to cancel major fundraisers. And so we've been working on doing things virtually. We've been working on seeing if there's any ability for them to, in some cases, contract with the county to provide essential services. I have also actually proactively reached out on behalf of some businesses that were actually inadvertently shut down. Sometimes a determination is made and it's sort of made, quite frankly, quickly, and then it sometimes needs to be reevaluated. So one of those actually was, interestingly enough, the beverage people. I'm actually a loyal customer, and I had heard from some other customers that they were shut down, and they're actually an agricultural processing entity. So technically, they actually could be open for retail business. And so I reached out to, the city, and the SRPD had gone forward and shut them down, but it seemed like they could actually, upon further legal clarification, safely operate because they allow folks like me who milk goats and do other things like that to actually, create more food, which is an essential service and an essential need for people. So you can take goat milk, you can turn it into cheese, you can turn it into yogurt. This is a little bit of a tangent, but the point is that this is not a perfect system. And I always appreciate people who reach out and say, hey, what's going on, before filing a lawsuit. So I, did not sort of know about them or their situation. And so therefore was not able to help or work with them in advance of litigation being filed. But I want, this is not a one-time thing, right? They are not the only ones who are suffering, unfortunately, from the impacts of the COVID-19 public health order, which was done in order to save lives, done absolutely for the right reason, but has obviously caused a lot of financial hardship on strain on small businesses as well as on nonprofits. So again, can't speak to lawsuit, but speaking generally, I always try to work with businesses to make sure, first of all, let's make sure that, were you truly supposed to be shut down, or was it an accident, right? Was there some kind of an error? And then if you were supposed to be shut down, are there other ways that you could operate, safely and within the confines of the public health order? So things like virtual fundraisers for different nonprofits and other things. So that's just my 2 cents. Again, can't comment on the litigation, but that's about what I've got. All right, gonna keep scroll. Oh, this is a great one. Erica says, I feel so sad for the graduates of 2020. What can we do as a community to honor them? 2 things. Number 1, go on Facebook and go to the Adopt a Sonoma County Senior Facebook page. It is awesome. People are literally adopting high school seniors, and they are giving them these dream baskets of, all of the things that whether they're Raiders fans or Niners fans or Giants fans or whatever, they're giving them sports memorabilia, and they're making them really cool, like poster board cutouts with pictures of them. And it's literally just strangers giving things to high school graduates. So I would highly recommend joining the Adopt a High School Senior Facebook page and try. I actually keep trying to adopt a high school senior, but everyone is so fast on that page that if you miss it, it's, the student is posted and then within an hour they're claimed as adopted. So that's a really fun thing. And I also wanted to mention a huge shout out to Councilwoman Nisa Hinton from the city of Sebastopol. She reached out to me a few weeks ago with this question, and she asked, hey, could the city of Sebastopol partner with the county of Sonoma to put up banners all around West County honoring our high school graduates? So we are in fact moving forward, and we will have banners that are honoring the graduates of Annalee and Molino and Laguna, and that will go sort of in the downtowns of Sebastopol and Forestville and Guerneville. So look for that coming very, very soon. We've also participated in helping arrange sponsorships for other high schools that are in West County. Some were doing banners and some were just doing yard signs. So we also connected on some yard signs for various high schools and are looking to support any high schools that we can through the 5th District office. Let's see. Okay. Helen says, part of the problem that for apparently nefarious reasons, the CDC changed their recommendations to surgical masks from a recommendation for N95s for people caring for COVID patients unless they were doing invasive procedures like intubations. So organizations are getting away with following less than safe CDC recommendations. It has come out today that those recommendations were not based on science. I completely believe that, and what I heard from the beginning was that those recommendations were based on supply, right? Not on what was really needed in order to keep people safe. So I hope that we can do better in Sonoma County. I hope that we can make sure that our healthcare workers get the N95 masks they deserve if they are in fact coming into contact with confirmed COVID-19 patients and they know that they are being exposed to those viral particles. So thank you for sharing that information, Helen. And again, I think that we need to keep having this conversation and see what we can do to make sure that our healthcare workers are protected locally. I do want to at some point, I would actually love to solicit from you guys any suggestions for future town halls. I'm kind of thinking that maybe a workers' town hall would be really helpful with, resources for folks, hearing from some of our, labor representatives and possibly especially some of our healthcare workers. Also thinking about, are there maybe housing or tenants' rights, things like that. We could get Ronit Rubinoff from Legal Aid to come to a future town hall. Feel free to leave any suggestions in the comments because I would love to bring in some more experts, and then maybe on a Sunday night and some future weekend we can have another town hall. Question or comment from Met. I live on the coast. There are a lot of cars and there's a few people that shouldn't be here on the beach, but nothing like overrun. That's good to hear. I think it was probably local. Question from Gerard. Miss Hopkins, can you please address opening up sports fishing for Bodega Bay? So rec fishing is currently allowed. Sports fishing, if that means bringing in visitors onto somebody else's boat to go out, we do not yet have that capacity to have that be allowed, but Merlin did let me know that Berkeley went forward to allow that, and so it's definitely something that I can look into and check out. All right, scrolling down. Question from Holly, any guidance on childcare, i.e. are facilities able to open to all families needing care or only families that are two working parents households? There's been some confusion in the early education community. Great question. So this is for non-essential workers. So if you basically childcare facilities can accept children who are non-essential worker children. So that does open the door to your usual students being allowed to actually attend preschool or daycare. I know this was a big challenge for the early childhood education community because a lot of folks, they have their 20 students, and of those 20, and that's what they need to, quite frankly, have all of their students, even if they're, in this case, would have to be separated into groups, right, and be in distinct areas, that they can't really actually make ends meet, or it's not financially viable to open for, say, 5 students. And so, unfortunately, a lot of them were caught in the situation of they had their 20 student roster, but only 5 of those students were actually the children of essential workers. They were not able to operate. So this removes the requirement for being an essential worker. So you can open and you can accept other children, the children that are non-essential worker children to your daycare. So I hope that helps, Holly. All right, and Gerard, sounds like you were referring to charter boats. So yes, so charter boats I am looking into, but that is not currently a legal use. Question from Mark, are there any plans for a random sample surveillance program? So we actually already have one of those, which is, a few things. Number one, we've been doing surveillance on high-risk populations. That includes healthcare workers, first responders, the jail, as well as offering tests to homeless residents, although I think a lot of homeless residents, understandably, don't necessarily trust government, and they have not a lot of folks have responded to wanting to be tested. But we are doing that kind of proactive surveillance testing. We also do have the test that literally anyone can call and go get a test. So that's also another way of a slightly not totally random sample, but it does allow anyone who wants to go get a test. So far, we do not have any plans to do door knocking programs like they have done up in Portland. I know in some other areas, they're actually literally canvassing neighborhoods to get a sense of whether someone might be positive or negative. So it's something that I can certainly bring up to Dr. Mace and ask if we have any plans about that in our meeting tomorrow. All right, well, thank you all for spending some time this evening with me. Hopefully I got through most of the questions. I will be here again Thursday night and on Sunday night after that. So I will see you next time. Everyone stay well, stay healthy, take care of yourself, take care of others. I know this is a challenging time. I know that a lot of folks are struggling financially as well as emotionally, but we're gonna get through this together because this is Sonoma County and we've got this. Hell, high water, pandemic, We are an amazing community, and I know that we're sometimes feel like we've been too resilient, right? We've had to be too resilient, but I know that we're gonna get through this, and we're gonna do it by taking care of each other. So take care of yourself and have a good night, and I will see you potentially if you want to comment on the Board of Supervisors meeting tomorrow. Take care.